Hi, everybody. Thanks so much for coming to our session on strengthening operational water quality monitoring for rural supplies, with a special emphasis on fit-for-purpose laboratories. So my name is Sarah Marks. I'm a group leader from the Swiss Federal Institute for Aquatic Science and Technology, group leader of the Water Supply and Treatment Group, and I'm really pleased to be joined by a great cast of characters coming from Helvetas-Nepal, the Water Project, COVA, and the REACH program, Oxford University. So the theme of today's session has to do with safety of drinking water at the point of collection and the point of consumption. But I want to clarify just one thing, that when we say operational water quality monitoring, we're really focused on the operation of the water supply system. So this has links to what you may know as public health surveillance, but really from the operational aspect, it has a lot to do with the monitoring and the management of the infrastructure itself. So there's a link to say what the WHO, UNICEF, JMP does, but it's much more ground level and linked to the maintenance officers of water supply systems. So we will hear from quite a few speakers today. This will be kind of a dynamic session with people getting up and down. There will be opportunity for Q&A. We will pair the question and answer with Menti quizzes so that if you don't get a chance to ask your question, you can give us feedback by way of Menti. Let's hope the technology works. And in terms of splitting our rather short session into two parts, we have first operational monitoring in practice. So we will hear from 3 organizations, and then operational monitoring strategies with insights from a learning history, and a little demonstration to show how tools that we're developing can strengthen monitoring. Then we'll wrap up with a reflection. So without further ado, I will hand over to Allison Gregory from the Water Project.
All right, good morning. So the Water Project works with partners in Kenya, Uganda, and Sierra Leone to provide sustainable water access. Today we're going to focus on our work in Western Kenya, where we're currently monitoring and managing nearly 1,500 water points. We are doing quarterly monitoring, water quality testing, and O&M on all of those water points. And we're working with 2 partners. When we first started water quality testing in 2018, each of our partners, there were 3 at the time, had portable field testing kits that they were using for the testing, and they each had their own water quality testing staff. We decided to centralize the water quality testing and the operations and maintenance to save resources, and there's been a few advantages to doing that. First, we were able to improve the quality control of our testing process and reduce errors by having a set lab space. We were also able to eliminate staffing redundancies by just having a few key staff members instead of having staff in each of our different partner organizations that were devoted to water quality testing. And we were able to increase the volume of tests by using laboratory scale incubators instead of the small incubators that came with the field testing kits. So we're currently doing all of this lab work in what we call the Western Kenya Regional Service Hub. We do water quality testing for each of our currently 1,500 water points. That number will increase over time, twice a year. And each time we do a sanitary inspection as well when we collect the samples. And other presenters will go more into costing. I just wanted to give an overview of how we are doing our cost breakdown in case anyone is interested in that. So the lab has been very successful for us, but of course we've had some challenges. So the first is supply chain. Finding affordable, high quality testing equipment locally in Kenya has been a challenge, so our solution has been to purchase some water quality testing equipment locally and also ship annually from the US some of the equipment that we need to get here, equipment and consumables. Of course, that has been expensive. Electricity can be spotty at our regional service hub, so it's hard for us to keep the ice packs frozen for sample transport. So we use cooler boxes, but that has been a challenge, keeping those water quality samples cold during transport. Of course, electricity also makes it hard for us to run the incubators overnight. If there's a power interruption and the incubator turns off, then we have to discard those samples. So we've addressed our electricity challenges by getting a generator, but that is another piece of equipment to maintain. Seasonality has been a challenge, coordinating sample collection for rainwater dependent sources in the dry season. If we send someone to collect a sample and there's no water, that's a waste of time and money. And the biggest challenge we're focusing on now is integrating our testing with water safety. So first of all, communicating test results in a constructive way that doesn't discourage someone from using a source that's safer than the alternative, and also following up in a consistent and timely manner with resolution and water treatment. And so we'll get into that process that we use more in part 2, but we're using the M-Water issue survey format to track and have accountability for that response. Okay, thank you.
Good morning, everyone. I am very happy to present this Fit for Purpose Rural Laboratory in Nepal. This is Madan Bhatta. I am working with IWRM program in Nepal. Here is some background information about water situation in Nepal. I would like to highlight that we have a 91% of water supply coverage. It's a basic coverage. However, safely managed water supply is only 16%, and mainly the lower coverage is due to water quality issue in Nepal that is associated with microbial water quality. Helvetas-Nepal implement IWRM program, which has a focus on construction of drinking water scheme, as well as we have been promoting this water quality issue. The main challenges in case of Nepal are we have a very geographically scattered drinking water small systems, and there is lack of public as well as private entities for water quality testing. At the same time, no availability of reagent and lab materials, and we also have lack of this chemist or biologist to do the water quality test, and also limited training opportunities. To address these challenges, actually we developed these local labs, and for that actually our aim is to establish an operational monitoring strategy for small spring-fed water supplies. And actually we have two interventions. One belongs to technology side where we developed these low-cost adaptable incubators, and these labs are operated by solar power. And another approach is we basically engage local people and develop capacity of local stakeholders, and basically we train these lab operators, managers. They belongs from health staff as well as NGO staff, and we train them at their workplace. If we see the cost of this Fit for Purpose lab, for laboratory it cost about $1,200 for lab, and for the training per event it cost about $1,000 to $3,000, and for the sampling it requires USD 2.5 per sample. Basically the sampling work is done by volunteers, and also they belong to the water supply who are managing or operating the system. Here interesting thing is this map I have taken from this Yanwas MIS system of Nepal water sector, which has been operated by Ministry of Water Supply, and Here is also, you can see these blue dots with cross, they are the individual water points of our system. And for the water quality test also, we can feed the data into this NWAS MIS system by using mobile apps. Uh, Here is more detailed information from one of the lab. It belongs to one of the scheme in Surkhet district, which is called the Satakhani drinking water scheme, where this rich fit for purpose project has established a small lab, and it is operated by this drinking water users committee. And they have started this uploading the data into NWAS MIS data. So if we see the result, here are some good improvement on the water quality. In first phase, 50% tap has safe water. At the baseline, it was 7% only. In phase second, it was 93%, increased from 20% at the baseline. The intervention in first phase, we did source protection, and in second phase, we did passive chlorination. And here are the technology that we use in passive chlorination. More information about these technologies. Okay, this is my last slide because of time limitation. I need to shorten. The learning and challenges, basically these locally adopted technology as well as training to local resource person. It contributed for the successful operation of the lab. At the same time, this enhancement of technical know-how of local stakeholders, it reduced the dependency on high-level experts like chemists from far away. Similarly, this data linking with NWAS MIS and digitalization, it helped for the use of the data for various purposes. One of the challenges still we have this supply chain, especially for reagent and other things. It needs to be procured from out of the local area, either from Kathmandu or even sometimes out of country. So project facilitation is necessary for this supply chain. Thank you very much. Now I would like to request.
Great, good morning everybody. Thank you for joining this side session. My name is Megan Lindmark, and I'm the Technical Program Director for COVA. And COVA, we work in Central America, so we're focused in El Salvador, Honduras, and Nicaragua. We operate kind of a unique circuit rider model that I want to explain a little bit so that I can convey the ways that we consider monitoring across this model. So COVA doesn't actually implement infrastructure. We usually elevate existing piped systems that are very similar to the ones that Madden presented in Nepal, gravity-fed pipe schemes. And we implement inline chlorination at the tank. And then we use our circuit rider model to service these systems. So teams of circuit riders usually serve 50 communities approximately with a variety of services, including capacity building, monitoring support, as well as technical assistance. So as Madden highlighted, this is the technology that we use. This is an inline chlorinator, similar to some of the ones they use in Nepal. And I'll give a very quick plug that if you're interested in learning more about this type of technology, there's a community of practice operated by an organization called PATH, as well as COVA, where you can learn more about some of these technologies. But they're very simple, and they're meant to be implemented into gravity-fed systems and used very low cost with no electricity requirements. So within our circuit rider model, our circuit riders or technicians are visiting these communities on a monthly basis, primarily to drive monitoring support. So my co-presenters have done a really nice job of highlighting kind of the challenges associated with laboratory testing as well as centralized kind of labs. And so we think a lot about the trade-off between routine operational monitoring and full-scale laboratory analysis. So we do both, but we focus on this operational monitoring more frequently. So on a monthly basis, our technicians are visiting each of their communities. So this is visualized here. They're going around their circuit, so to speak, and they're delivering this free chlorine residual monitoring. So this is most closely related to the technology that we deliver, and therefore is the best kind of proxy measurement for safe drinking water. But we know that chlorine doesn't tell the whole story, so we also balance this with E. coli and physical and chemical parameters measured at the actual centralized laboratory. So we operate our own lab at our office, and so for communities that are close enough to this lab, so the circuits that are the most close to the centralized point, we can still pick up samples. The circuit riders on their circuit can pick up and bring back samples to do the full-scale analysis at the laboratory. But in some cases, this doesn't really make sense. For some of our circuits, they're much further away from where our lab is based, and instead we have to kind of decide whether or not we do kind of like lower cost field tests or establish kind of a fit-for-purpose temporary lab to do a bunch of lab testing in that region at once. So we think about these trade-offs on a routine basis in order to deliver all of this monitoring across the year. And I'll emphasize again that the chlorine monitoring is happening on a monthly basis, paired with then these E. coli samples being collected on average twice a year, but sometimes up to 4 times a year. And all of this data then gets fed up into mWater, which is our digital platform that we utilize for all of our data collection, which is really useful because it allows us then to compare, okay, this community had 90% chlorination rate, and you can see that that resulted in 0 E. coli in the follow-up samples. So with that, I think that takes us to Marissa.
So thank you very much to our presenters. I think they really showcased how these fit-for-purpose labs can work in different contexts. And well, now we want to hear from you. What can you imagine, like what could be the challenges that arise in rural water quality monitoring? So please scan that QR code. You can also join directly in Menti, and we'll try to generate like a word cloud, and while we do that, maybe we can take 1 or 2 questions if you have specific questions for the presentations. Yes?
Yeah, I have a question for Allison specifically. So Allison, you talked about some of the challenges with cold chain and some of the challenges with like incubation because of energy use. I know there are a few different options for like field-based E. coli tests that don't require cold chain, don't require incubation. So I'm just curious, like, what led to your decision to go that route rather than the field-based kits that don't have those same challenges?
That's a good question. So I think ultimately it was cost when we considered, so the only field-based kit that we considered that we actually, some of our other partners use that I would say doesn't need the cold chain is the CBT, like the aquagenic CBT. And so some of our partners in other countries use that and it's worked well, it makes sense in that setting, but cost-wise, it was more affordable for us to do the plate count testing, cost per test, and just the volume that we're doing in Western Kenya. And the distances aren't huge, the travel time isn't crazy to get the tests from the field to the lab. So yeah, even with the issues with ice, it still seems like we're able to keep the samples, cold enough to make it worthwhile cost-wise. Good question, thanks.
I just wanted to ask a question for the first presenter. After sharing the challenges, do you see or have you had a chance to think of intervention of sustainability aspect of the lab? And have you coordinated with the government, to sustain those labs and the challenges you're facing? Could you share more on that?
Yeah, that's a good question. The sustainability of the lab. So right now, we are an NGO, and our NGO is funding the lab. So yeah, long-term sustainability. Are you thinking in terms of like funding, like what would keep that going? So we've started a subscription program with our operations and maintenance side of the regional service hub, where we're starting to get communities to subscribe for operations and maintenance and water quality testing. So we are piloting this model of getting contributions from the community like annually for the services, And it's not enough to cover all of the expenses that I showed you here, but that's kind of the step that we're taking to make it more cost sustainable. And we do collaborate a lot with the government in Western Kenya, but specifically with the lab, we have not. And I think that's a great idea. We could, try to integrate the government into our water quality testing work more, and like from a sustainability side would be great. Thank you.
We actually have time for one more question. We're a bit ahead of schedule.
So, when you guys start like making decision on your analytical interest, whatever contaminant it is, it seems like you guys are mostly focused on pathogens, which is fair because these are the most common contaminants. But with the increase of industrialization, there has been increase of a lot of chemical contaminants at the same time. So when you guys start assessing the risk, do you guys screen all the type of contaminant, then make a decision, or just go with what's been detected beforehand?
Yeah, I can take that question. So our general plan when we enter a community is to conduct a baseline for all the parameters required by the national government, as well as a few additional that are of kind of international concern. And then from there, we repeat sampling if something comes up. So we do try to screen for as much as possible when it comes to the physical and chemical parameters that you're talking about, based off of what is required at the national level.
Okay, so thanks for that. Thanks for your questions, and also this input is very interesting to me because while technology is one of the common answers, you can see there's a whole range of other factors that really surround the technology. A lot of them that you can call so-called soft factors, things that you really have to consider in terms of training, staff time, costs for materials. So it's quite an interdisciplinary challenge. I'm gonna see if I can, Marissa, I think it's there. We can just go to part 2.
All right, so thank you all for your questions and for your input to the Mentimeter. I'm Saskia Nowitzki. I work on the REACH program out of the University of Oxford, and I'm gonna just spend a few moments sharing some insights from a learning history of fit-for-purpose lab development in Nepal, Bangladesh, and Kenya. For those who have maybe not heard this learning history concept before, so learning history is a participatory action research method. It's a process for trying to both foster and also capture organizational learning in the implementation of different initiatives. It's something that's being used more and more with initiatives that are trying to generate positive socio-environmental change and grappling with some of the systemic complexity in doing that. So for this learning history, we have been drawing on work in Nepal, which is with Helvetas, as Madan has already shared about, and then also in Kenya and Bangladesh. So I'm going to spend just a few moments to introduce you a bit to those cases as well. So in Kenya, we have been working with Fundifix, and in Bangladesh with Haisawa, with their operations located in Kitui County in the Kenyan case and in Khulna district in Bangladesh. So both Fundifix and Haisawa are professional service providers. Fundifix is a social enterprise registered in Kenya, and Haisawa are an NGO. And they are both have been developing and working with fit-for-purpose labs. So to just give a bit more of a sense of where they're working. So in Kitui County, it's a semi-arid climate zone, drought-prone, quite sparsely populated, so we're dealing with long distances between water points. And some of the key water quality challenges faced there are microbial contamination, where is it not a challenge, and also geogenic fluoride and salinity as well. And Fundifix are serving community water supplies primarily, and their services reach, it's estimated around 70,000 people currently. In Khulna district, we are then in a very different climate zone. It's much wetter. In coastal Bangladesh, they are facing cyclone risk. It's much more densely populated, and some of the key water quality issues, microbial again, geogenic arsenic and manganese, and also saline intrusion. And Haisawa are working in Khulna mostly with schools and healthcare facilities, so their service focus is a bit different. And despite these very different contexts, the fit-for-purpose lab setup and the way that they're working with water safety management is actually quite similar. So there has been a lot of cross-learning between these two organizations through the REACH program as well. So I wanted to just share some photos to give you more of a sense of their operations, and particularly to introduce Mary Musenya Sami, so Mary, and Zanatul Fardous. So they're respectively leading the water quality, water safety efforts with these two organizations. They were brought in specifically to do this. But because Fundifix and Haisawa are layering their water safety work on top of their wider maintenance and operation activities, the water safety work is also supported by the wider team and the maintenance technicians as well. So as I said at the beginning, we've been using this open system learning history approach. It has 5 kind of main stages. Particularly for this stage, which is around data distillation and sort of thematic generation, we have also used the RE-AIM framework. So this is something that comes from the implementation science field. It's a way to structure an assessment of interventions, and points directly to points you to think about 5 main domains in doing this. These are about reach, so who is benefiting, who's being reached by the intervention. In this case, it's a fit-for-purpose lab that we're sort of using as the intervention. Effectiveness is about the results. What are the actual results of what you're working on? Adoption is about uptake, and is it scaling? Is it spreading this intervention? Implementation is really looking at whether the activities that are being done, how closely they align to the initial design, and maybe how that design for implementation is evolving. And then the maintenance and sustainability is very important, looking at sustaining the results of this intervention over time. So I really appreciated the question about sustainability. So yeah, if anyone wants to know more about those methods, do reach out to me. I'm happy to say more. But for now, I just want to highlight 4 kind of main pieces that have come out of this learning history work. The first is about learning within the organization, and I think it's important to maybe think back to where we began with this, and I want to use Fundifix's case as kind of an example here. So when Fundifix initiated their water quality work, it was because I showed up as an overeager PhD student ready to do some field work and started bugging them about helping me to test water quality. At the time, the mindset within the organization, within Kitui County more broadly, nationally, and also internationally, and we know this from doing a lot of interviews, was very much that water safety is not something we can do right now in lower income rural areas. It's, while there's still so much work to be done on access and reliability, we can't be thinking about this yet, and that it's unachievable and it's unaffordable. So that was the mindset, and then we started just with a little bit of testing to see, maybe what are some potential health issues that might be related to the supplies that Fundifix is working very hard to maintain and operate. And through that, increasingly there became an openness to learning about water safety within the organization. And so they've reached a point now, after several years, so this began in 2017, where they're not just assessing water quality through testing and also sanitary inspection work. They're also sharing what they're finding with community leaders and with the government. And they are managing some of the risks that they have found, so particularly the fecal contamination risks. They've done a lot of work now to roll out water treatment to many of the systems that they're managing. And I think this is where, so Fundifix and several other, 26 other projects across the world have contributed to a study that we did. A student, Meryl Lowen, who we worked with in Oxford, did this study to really look at what does it take to sustain treatment in these kind of settings. And so if anyone is interested to see sort of how the role of a service provider really links up some very important pieces in the enabling environment to sustain treatment, do take a look at that study. If you have trouble finding it, just shoot me a note. I'm happy to send it to you. Okay, so if anybody was with us on Monday in the Operationalizing the WHO Small Systems Guidance with Results-Based Funding session on Monday afternoon, then that setup, that framework of kind of assess, report, manage may already be familiar to you. So this is just to highlight that a lot of the learning that came out from the work that Haisawa and Helvetas and Fundifix have been doing has really informed the design of this results-based funding framework, which Uptime Global have piloted this year with several service providers, including COVA, and are going to be rolling out with many more of the service providers from 2025, including with the water project. So the learning is continuing, and really there's a big emphasis on context and place-based appropriateness with these fit-for-purpose approaches. So if you want more on that, do check out the report. Okay, so then extending learning beyond the organization. So this is coming to the point about government and sustainability. So, and I want to switch over to talking about the Haisawa example. So Haisawa as an organization are part of a wider set of stakeholders that make up the Safe Pani program in Bangladesh. And so in addition to using the insights that they are generating from their monitoring to inform their repairs and improvement work, they are also reporting to community leaders, so in this case managers at schools and healthcare facilities, and also reporting to a higher level steering committee which has representation from several government departments and other sector leaders in the country. And so spreading what they're learning further afield. And that has been a really, really important part of demonstrating to the government of Bangladesh the value that a service provider like Haisawa can provide in these spaces, which has then led to the government committing to fund 50% of the cost of the service in the entirety of the Khulna district until 2030. And there are conversations about how that may even scale further beyond this if it continues to demonstrate good impact. So that brings me to this point about affordability as a moderator of inclusion. I think it's really important to always keep this in our sights, particularly with who is benefiting from fit-for-purpose labs, who's benefiting from this intervention, if we think about the REACH component of this. Obviously, only people who are able to and choose to use the services being managed by these service providers are benefiting from the work that they're doing out of their labs and with their water safety activities. So it's really important to think about what is driving that choice. Proximity is a big part of it. So having efficient and easier access to supplies that are managed, but also affordability is a big part of this. So it's, I think, really important to emphasize that the ability to pay for this type of service is not sufficient to recover all the costs of the service just through tariffs. There is a cost gap. So if we're serious about delivering services that are, SDG safely managed, then we need to be serious also about addressing that cost gap with the difference between what it costs to do this and the ability to pay. And I really want to emphasize that this is the case whether or not we're talking about water safety. So even just the cost of doing the maintenance and the functionality and keeping supplies running, we don't have that cost recovery just from tariffs. So I always think it's important that we keep that in mind. And then finally, just as my last slide, I wanted to say that we are writing up this learning history, so there'll be a lot more information about it if anyone's interested. And really the focus of this is how do we get to fit for purpose? And so it all comes down really ultimately to this guiding question of what actions will water quality testing inform? So starting with that, what do you want to do with the information? And then from there, the answer to that being your guiding star, we can start to look at all of these other more detailed questions of what you test for, when, where, how you do it, how you manage the data from that. And so through the learning history and the wider work collaboration, we have developed some tools and guidance to start thinking through some of these questions. So we're going to switch over to looking at those in a bit more detail now. And then, of course, the session following right after us, looking at field testing methods, is also very relevant to this too. So
We have time for a question or two. If anyone has questions for this learning history, so we're a bit ahead of schedule.
I got one. Tanner Hoffman with the Ugandan Water Project, and just for a little bit of context, we operate an operation and maintenance service for rural water supplies in Uganda. Obviously, the water quality piece is a value of us, it's an interest of ours, but what's also very important is being able to operate a financially sustainable enterprise. So the affordability piece that you mentioned is very important to us, because we want to test, but it also needs to make sense within the business model that we're operating. So you talked about, you know, the financing gap, and certainly uptime can help fill that gap. There's other funding sources out there that can help fill that gap, but that gap is a lot easier to fill if we're keeping our costs down. So you mentioned affordability specifically. So with that as context, you know, what were you seeing from your research as elements of factors that helped organizations who are doing this type of regular testing keep those costs to a minimum?
yeah, that's a great question. There's of course two sides to the coin. It's not just about more funding, it's also about cutting costs. So I think one thing that's been interesting to see across all of the three cases in this learning history is that initially, when you're really just starting to understand your systems, there can be it can be more difficult to get to the efficient answers to this. And so there's more learning that happens in that initial time, and then over time you start to learn where are the most important kind of trigger points. What do you need to be focusing on? And so I think across all of the cases there's been a narrowing of what the focus is, to really hone in on what is most usefully informing actions. And so this is part of what's driven for the results-based funding framework that Uptime is now using. It's partly what's driven our focus within that framework as well, is learning, you know, what actually has been useful in these three places. And then there's also, I mean, there's ongoing development in the field testing space, in the institutional space, and so I think there's also, it's important to have that openness to not being like married to any one way of doing things, but continually open to evolving if there is a more efficient way to do something. And I think there's some really exciting sort of technological pieces and innovations coming down the pipeline as well that will further support this. Now that there's a space here, I mean, when we were working with a mindset that this just can't be done and that we need to do reliability and access first and think about water quality later, that sort of mindset really shuts down innovation and cost efficiency measures that, you know, now we can start to see a lot more creativity in that space, I think, because there's just more people working on this. Cool.
Thank you. All right, so I was told to check Zoom for questions, although I'm not exactly sure how.
I realized I can only see public questions, and the default is to keep them to anonymous.
If a question pops up and that you notice one, and just let us know, but we'll just keep moving then. Maybe we'll skip this. All right, great. So many thanks to our speakers who sort of set the scene, and I hope one point you've taken away is there's a huge diversity of experiences, challenges. There's also quite a few commonalities that we hope we have drawn out so far, all for, you know, considering if you can fill up a container and drink from it at the tap and consider it safe. But what I want to do, as this is the High Income Country Day, is we're going to turn the lens back on ourselves just for a moment. This is a little demonstration of sorts. we thought how better to get to know the tools that we're currently working on that will hopefully be available and useful to you soon than by thinking about our water collection point here at the Friday Center. So many of you have seen this, and we assume that this water collection point has been used to fill up our water containers. And what concerned me at lunch, starting on Monday, was that some of our containers were quite turbid. So I don't know if you all have been drinking this, but we wanted to investigate. So we took a journey to the hills behind the Friday Center, and there happens to be a very nice rapid sand filter. And when we had a look at it, you know, it looks like it's working fine, but why is lunchtime water looking that way? So a tool that is very useful for this question and, you know, easy and cheap to use are visual observations by way of sanitary inspection forms. Thank you to the WHO for this handy guide. And if we go through this checklist, we may see some issues with our roughing sand filter. However, to triangulate an answer towards risk, it's important to combine those observations also with water quality testing. So I don't know if I have to even explain this to the people in the room. Hopefully it came through, you know, with the case studies, but let's just walk through this for a moment. So we leaned on our handy laboratory technician who I found amongst us, lucky for us, and he even had his sampling container on hand. So in order to really assess this risk, including water quality, I happen to have my little lab kit here on the chair, and Rick was very kind to humor us and set this lab up. So we had a look at Friday Center water. However, and this is the however, this lab was not quite up to par for the testing that we had to do. So we happened to be missing a millipore filter. That's pretty critical. And disinfectant was running low. We also were running low on reagents for chlorine testing. So of course we can confront these challenges one by one, but through our REACH collaboration, what we really want to look at are more structured ways for addressing laboratory function and capacity at scale so that we can make decisions in a more systematic way. So with this, Marissa will lead through the tool explanation.
So now we saw the lab and it was not properly functioning. So we wanted to know how can we upgrade this lab and do more tests and ensure water safety in here in this lab. And so this is where this tool, this rural lab assessment tool comes in. So this can assess the capacities of the lab with different categories such as the competence, knowledge of the staff, reagents and equipments, others to like safety management, record keeping and communication, and others. So let's have a look at how we assess this exactly. I'll just go through reagents and equipment. And so we have this questionnaire, and as we saw, like there were not enough reagents, for example, for chlorine testing. So the question of sufficient reagents or relevant consumables will answer no. And then also we saw that the incubator was not working properly, and this was because there were frequent electricity cuts. So based on this, we can then generate, so there is a report that is generated. On one hand side, you can see the different categories and subcategories, and here with a color ranking, so that you can already have a look. And then here is like the summarized form of the different categories. So we can see reagents equipment, as we saw, has some issues, but also quality control procedures and record keeping and communication are some of the deficiencies of this lab. But this lab tool doesn't only show you what is wrong, but it also links to a forthcoming manual that we are developing with Eawag and the different partners under the REACH program, and also to other training resources. So now Sarah will take you through another group.
Okay.
You can.
So next in our exercise, it's time for action. And so we can use, what we use at the Water Project is the M-Water issue survey. It's a special survey format that has 3 steps, like open, resolve, and close, and you can fill in what you want those steps to be. So at the Water Project, we use an issue survey to do the follow-up when we get a water quality test result that shows us that the water needs something for it to be safe to drink. And so the first step here is opening an issue, and it's just documenting the problem, and now the issue is open. And then we go to the next step, and the next step of the issue survey is called resolve. And for the resolve step, we track communication of the results. So we want to make sure that the water users know that we've detected the E. coli in their water, or I guess the turbidity in the water pitcher. And so to keep ourselves accountable, to make sure that that gets reported, we document that communication step.
Yeah, so keeping with the theme, and I just want to mention that some of the tools that we've just shown, like for example, the lab assessment tool, we're aware also that there are other tools available. I've seen the water card tool, which is really fantastic from Aquia. But what we're trying to do here is really bring this to maintenance officer level. And the laboratories in that case may be outside of the regulatory space for the time being. And so this tool can really be tailored to sort of a more incremental process. And what we want to show is this upward evolution whereby with the help of the M-Water platform and opening an issue, then treatment interventions can become more obvious. So in our case, very robust disinfection system and upgrades to the roughing sand filter above the Friday Center. And this took some time, of course, but 1 month later, we could take another sample at another conference. And in addition, thanks to the tool, our laboratory has now improved as well. So we have a functional incubator, plenty of supplies. And so this may include more iterations than just one round, but the incremental upgrades is something that many of us working in rural water quality space are familiar with. So Marissa will quickly go through the resolution, and then we will wrap up.
Yes, after all these improvements, we wanted to assess the lab again, of course, and we can see like some things have improved. We made sure that we have a supply chain that is providing us with always enough consumables. We also built some solar-powered incubators so that we don't experience these electricity cuts anymore. The incubators are working. So based on this and other improvements, you can see in blue was the situation before, and in red is the situation at the lab right now. So there has been some improvements that have been done. So now we went to take some verification samples, and as you can see, they're quite good. And that's when we can again like look at the M-Water tool.
Yeah, so in the final step of the M-Water issue survey, when we're closing the issue, so we're documenting that the problem has been resolved and we've closed it out. And so for the close step, we document if any, when we did the follow-up sanitary inspection, were there any issues that needed to be addressed? And if so, has the community addressed them, or who has addressed them? And we also document if any treatment was needed, like was that treatment step taken, when was it taken? So just creating this accountability mechanism for us to be able to say, to go ensure that we're going through and following up every time when we have water quality issues. And M-Water also allows us to visualize the whole process, which is really cool. So it's been great for us. That's just the part of the same close step.
So,
With this, we hope that you can enjoy your water at lunch now without any concerns, with no worries. So right now, so we saw mostly these two tools, and we want to ask you now, do you see a need for these tools to strengthen rural water quality monitoring? And they're still at a level where they can be improved, so we also want to hear from you. What do you see, like how could they be improved? So for this we also have a Menti. You can join and you can just type whatever you want to tell us, also giving us feedback. And during that time we can maybe have questions as well.
for the next, if you go to the next slide, we can move straight to the reflection as well as questions and feedback, but we would just really appreciate documentation at this stage of the development of our tools, your perspectives from your organization, or if you can imagine, how this could be useful for you. Please.
Hi, my name is Savita. I'm from University of Sydney, but I'm from Nepal, so I do have experience working in Eawag in Nepal. I think it's going to be interesting just to assess like your capacity and which water quality protocol to use with this tool. And I was just thinking like, is this tool at the end, is it going to be used for the like research purpose for like the projects or like researchers, or do you aim to like also tailor it at the end for the user communities? And I'm also wondering, because in Nepal, when I was working there, we worked a lot in mainstream the water safety plan right by WHO on the rural water supply, and they do have a robust framework on identifying the risks and then like doing the monthly meetings and then making like who is responsible for whom within the water user committee. Although there's a lot of problem with the sustainability and long-term monitoring within the water user committee on implementing the water safety plan, I do see a lot of things coming again with the water safety plans, and water safety plans have been a major mainstream in a lot of rural water supply tools. So I'm just thinking like, if this is aiming for the rural water supply community, is it going to be another tool for them to use it, or how is it going to complement with the water safety plan, or is it going to be confusing for them to again use this another tool? Because it already does have a framework on like identifying the risk, doing the water quality monitoring, and who is going to do the risk, and like for example, it does have a documentation in a form which is like writing in a paper on who is going to like when is the next meeting going to be had. So I'm just thinking like what are the overlap, are the user committee going to be confused, or it's going to be helpful at the end more?
It's a great question. Maybe to start is it's important to distinguish between the two different tools, one being laboratory capacity upgrades. I see as complementary to the water safety plan iterative approach to improvement. But the M-Water tool, I guess it's interesting to think, is the M-Water tool linked to water safety planning, the form that you're mentioning, and is it complementary?
I guess it's complementary. We do sanitary inspections in parallel with like tracking our response in the issue survey in M-Water. So I think they go hand in hand, and it's a way of making sure that we're really following up and resolving and whenever we have water quality issues.
We can chat more after, because it's an important point. I mean, it's geared towards practitioners and it can be useful for researchers, but we absolutely want to complement processes that are already happening. And I think we will shift now to reflection, the questions that are on the last slide. Thank you very much for the feedback here.
Yeah, just thank you very much for the feedback. So we can see there are like some, for example, we have to look into sustainability and some other feedbacks that are really, like we really appreciate that. So
You can leave it up and find out who's doing the humanitarian context.
Right. So thank you all for joining us so much. I'm Katrina Charles. I've been working with a number of these teams on different parts of this, and I think the presentations have highlighted really nicely the importance of operational monitoring, of how it can help providers to improve their practice and to improve the way we're moving towards safe water. So it's not just about surveillance, but also thinking of what data do people need to make actions at their ground. Saskia highlighted that assumption that we had a few years ago that we can't do this, but what these teams and many people in the room are showing is that we can do this. It's not too difficult, it's not too expensive. We do need help, but it's not too expensive. But it's more than just doing a test as well. It's very much aligned with more safety planning, with system strengthening, of really thinking, making sure we can give teams doing this work a choice of how to do this, but also an informed choice about what's going to work for them. And across this, I mean, there's a diversity of ways to achieve water safety and the operational monitoring. So we've talked about fit-for-purpose labs. The next session is going to talk about the water quality field testing kits and how do you choose them as a different mechanism. And I think all of the teams also used accredited established labs for some of those samples as well. So it's not like there's a mix of different ways to do this. Across these presentations, it's kind of highlighted some of the challenges around data management. I was really interested to see quality control coming up so solidly in that first Menti, but data management kind of not, as two parts of a very important system. There's the supply chains, and that's the same for whether it's a fit-for-purpose lab, an accredited lab, or a field test. The human resources, so people raised issues around training, retaining staff as well. And then, but there are always trade-offs. When do we do it at the lab? When do we do it in the field? When do we send it away to someone else's lab? And those trade-offs come in with, are related to the cost, the distance, the travel time. They're very complex decisions. So what the team here are doing is, as they've highlighted with these tools, is they're very committed to sharing across the sector to understand the different ways we can do this and to learn from others. So in addition to the manuals and tools that have been demonstrated here and that are coming up, will be available shortly, I wanted to highlight the Aravosen Rural Water Supply Network, thank you. Well, good yes. They have a group on water quality where we're sharing this more. There is a community of practice for inline chlorination, which was mentioned as well, which Megan mentioned, and then there is, and they have a webinar coming up with Aravosen as well, where you can get more information. So, there's lots more information. We'd really love to hear more from you. If you've got other things you think you can add into this discussion, so do reach out. And do please stay in the room to learn more about water quality field test kits with the WHO UNICEF and course teams as well. So thank you very much, and thank you to our presenters. I know, it's okay. Thank you. Thank you. Realize you should have made it clear this mention in my too. That take the team, if there was three of you, trying to it's a whole team. Yeah, it's not just one person.